When using diagnostic tests to detect whether a person or an animal have the disease, it is important to know how well the test differentiates the disease from healthy and correctly sort the two categories. False positives result in having to treat or quarantine a healthy person or an animal and treat their environment collectively, whereas false negatives result in letting a person or an animal having the disease to be out and about among others, which can contribute to spread the disease more. Such diagnostic tests are like court systems and the judgments. When judging whether a defendant is innocent or guilty, the null hypothesis is that the defendant is innocent, and the alternative hypothesis is that the defendant is guilty. If the court incorrectly concludes that they are guilty and send an innocent person to jail, that is when the type 1 error of judgment occurs. Similarly, the court incorrectly concludes that they are innocent when the defendant is actually guilty. That is when type 2 error of judgment occurs. Deciding whether a type 1 or type 2 error is better depends on the context and the consequences of each type of error. In the context of the criminal justice system, a type 1 error or convicting an innocent person is generally considered worse than a type 2 error of acquitting a guilty person. Whereas, in a health program aiming to eliminate a disease, the opposite is true. When using a diagnostic test in a health program aimed at eliminating a disease, it is generally more acceptable to have a higher rate of type 1 errors or false positives, rather than type 2 errors or false negatives. Even though a type 1 error might mean some individuals without the disease get unnecessary treatments or quarantine, which costs money, it doesn't harm the overall effort to eliminate the disease much. But, if we had let more type 2 error or let false negatives to be free in the population, infected individuals are not identified and treated, and we are allowing the disease to continue spreading, when in fact, elimination was our goal.